Should we head?
Just tell how to go.
Right. Well, hello everyone. Thank you all for coming so far north to Newcastle. It's a pleasure to host you guys to come here and support each other and maybe learn a bit and network and do everything that you need to do. So lots of friends and familiar faces and some new faces too. So really nice to see you all. What I'd like to talk to you about today is a bit of an update on our national study that a lot of you are actually part of, or you have heard of, and you might not have heard it, and if you haven't, this is the time to hear about it. So this is our attempt as a group of professionals interested in understanding these diseases. This is our attempt to move forward and to move the UK forward in our understanding of these diseases. So, what am I going to talk about today? I'm going to give you a little bit of background, just so that we're on a level playing field, and then I'm going to tell you a bit of background about the study, and then where we're up to with our recruitment, a little bit of information, and then for the first time we've got a few results coming through, and we've been starting to present those at national and international meetings, so it's the time to share with you a little bit about what we've been finding. And then perhaps a little look towards where we go from here. I'm not going to go into intricate detail about complement and immune systems because we have a number of far more qualified people over here to do that bit. So I will mention those words, but don't worry, don't freeze over because it will all become clear later. But I'll use those terms just in terms of the bare minimum that I needed to help explain the study to you. So, what diseases are we talking about? And I had this slide last year because I'm aware that there are people in the audience who will have been given a number of different diagnoses, or sometimes diagnoses that don't even perhaps appear here, but sort of come under this umbrella of MPGN, C3G, dense deposit disease, etc. So, basically, when I talk about the national study of MPGN and C3G, that can include any of these diagnoses that you may or may not be familiar with. I hope you see your diagnosis up there. To run through them, the first two, these terms, membranoproliferative glomerulonephritis and mesangiocapillary glomerulonephritis, are interchangeable. So one was European, one was American. So they are the same thing. So that's the same thing for the type 1 and the type 2. These two terms are interchangeable, and of course type 2 is also known as dense deposit disease. And then the more newer terms that have started to come through, C3 glomerulonephritis, C3 glomerulopathy, and others. So if hopefully you see your disease on that list, or your loved one's disease on that list, and that's what we're talking about. We're talking about this national study, and I found this cartoon, which I thought was quite appropriate for these ridiculous names that we've given these diseases. So, just a little bit of background on the diseases themselves. So, hopefully you're all familiar with the picture of the kidney here, and within each kidney we've got about 1 million little filtering units, and that's one of these, and they are called glomeruli, or glomerulus in singular. And it's basically a little ball of blood vessels where the blood flows in under high pressure, it's squeezed under the pressure, and waste products and excess water and salts come out and go through to form urine, and the remaining blood flows out of the little filter unit. And so, as I said, you've got about 1 million of those in each kidney, and the job of those little filters is to clean the blood and make the urine. That's what they do. And if you were to take a piece of kidney, many of you have had biopsies, and you prepare it specially and look at it under a microscope, this is what one of those looks like, and you can sort of see the capsule around the outside, and then this is the blood vessels. My printer's not doing very well. You can see the blood vessels in the middle, and so that is a normal glomerulus, normal filtering unit. So when you get one of the disorders that we're talking about, you'll all know that it's diagnosed on a biopsy. You can't be given one of those diagnoses without a biopsy. And we've traditionally named them according to what they look like on a biopsy. And hopefully you can see the difference here between a normal glomerulus and one that's affected by one of these disorders. So you can already see that this one's got lots of nice open spaces where the blood flows through, and this one's stuffed full of extra material. And it's much more pink when you look at it. And the difference here is that the one on the right with the disease has got extra stuff in the glomerulus. And that extra stuff is basically deposits of various parts of the immune system. And Kevin will be talking later about what these different elements are. But often in these conditions there are parts of the immune system, complement, immunoglobulins, which you'll hear more about, which normally are present in our body, fighting disease, fighting infection, but for some reason start to deposit more in the glomerulus. And you can see that a nice happy glomerulus does well, filters blood, makes urine, regulates the blood pressure, doesn't leak blood or protein. But a diseased glomerulus like this is unable to do those jobs properly. So what you guys know as the symptoms of your disease are a direct result of seeing this happen to the glomerulus. So the blood doesn't flow through so well because it's stuffed full of all this extra stuff, and therefore you get poor kidney function, you're not cleaning the blood. The damage to the filters leads to leaking of blood and protein, so they're leaky. And because your kidneys regulate your blood pressure, one of the common problems that people with these disorders have is really high blood pressure, because all this extra stuff in the glomerulus is really affecting the kidney's ability to signal the right blood pressure. So all of those signs and symptoms that you know of as part of MPGN or related disorders can be down to this. So the question is, why does that happen? Why do those glomeruli look like that? What is it that's happened to them to make them be full of all these immune proteins and not work properly? And that's what we're about really, is trying to understand why you go from a normal glomerulus to one that's stuffed full of immune proteins and doesn't work properly. And part of that is understanding what those proteins are, what things have been deposited that shouldn't be there. And this just shows, so you now are all experts on kidney pathology, so you now know that these are little glomeruli, filtering units, and they're all not right. They've all got far too much pink and purple in them. That's all you need to know. Too much inflammation, too much cells and deposits. And if you stain for special proteins, you can see what these actually are. So you can label them and say, what is that protein? Does it light up for this particular protein or that one? And this is a complement component called C3, and a lot of you will know of that, C3 glomerulopathy. And it's the most abundant complement protein in the blood, and it shouldn't be deposited in your kidneys. So that, under a special microscope, shows that these kidneys are stuffed full of C3. It shouldn't be there. There are also other things. If you try to light it up for other proteins, they would often come up positive. And this is a really powerful microscope study of the kidney. And this just shows that if you really, really drill down, you can see these deposits that shouldn't be there. These are all in different places in the kidney. And what we've always done before is named these diseases according to what these findings are, what they look like. So we've said, oh, the deposits here are in this place, therefore this is type 1. The deposits here are in this place, therefore it's type 2. And, oh, we're not quite sure about these ones, we'll call it something else. And so previously those names have come because of what they look like. Now, those of you who were here last year, sorry, my animation's not very good. Those of you who were here last year will remember my fruit analogy. And I've tried to develop it a bit further, so it's a bit better this year, I think. So, what we're trying to do with the National Study of MPGN is to understand what type of fruit we've got. So we might look at the top half of the slide and say, well, over here we've got red fruit, because they're red. And over here we've got yellow fruit, because they're yellow. And over here we've got green fruit, because they're green. But we know by looking at that an apple is not equal to a pear or a strawberry. But because they're red, we've called them that. So what we're trying to do is to, each piece of fruit represents a patient, sorry. And basically what we're trying to do is understand what is it about this particular piece of fruit here that makes it an apple. It's red fruit, but actually it's an apple. And actually by understanding the fact that this may look like a yellow fruit, but it's actually a different shape, and therefore we can separate it out. And so we're trying to regroup things according to what they actually are, what's actually happening, rather than what they just look like at first appearance. And I'll put this down here because I'm sure that as time goes on, we will have things that look like apples, which are really oranges, and similar. So that's a kind of what we're trying to do with the national studies, trying to understand what makes these what they are and what they look like, and look much more closely at them rather than just take things at face value.